right. Good morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a moment here to click buttons to make sure that all the media have permission to record. As always, you will have permission to record, and we are also recording, and we'll make that video available later today on our YouTube channel. Okay, just a moment. Okay, I think I've gotten everybody, but if I missed you, if you have issues, please send a message to the chat box to the Joint Information Center and I will get that fixed. All right, this morning we're joined with Snohomish County Executive Dave Summers, Snohomish Health District Health Officer Dr. Chris Bitters, and Snohomish County's Chief Recovery and Resilience Officer Kara Main-Hester. Each of our speakers will give an update, and after they've shared their remarks, we will take questions using the chat feature. Please make sure to send your questions to everyone so that all of our speakers can see. Thank you again for joining us. And with that, I'll turn it over to Executive Summers.
Well, thank you, Heather. Good morning, everybody. Good to see you. Thanks for joining us today. So we'll be hearing about our really promising COVID trends here in a few minutes, but I wanted to take a second to touch on part of our both recovery and resilience efforts in Snohomish County. And I think for those of us who live in urban areas, we take it for granted, but broadband access and access to the internet is something that I think COVID has really demonstrated how critically important that has been and is and will be in the future. And for folks in more rural areas or many parts of the county and the region, frankly, they don't have that good access, and in many cases no access at all. And it really puts them at a disadvantage for really getting access to essential services, schools, online education, online work and telecommuting, telemedicine. If you don't have broadband access, you're really stuck and at a disadvantage. And we know that that's the case in many parts of the county. So part of our looking forward to the future to make Snohomish County and the region more resilient is really to focus on broadband access. So we're really excited about the announcement last week that the Washington State Broadband Office has granted us $16.7 million to bring broadband to almost 6,000 homes on the SR 530 corridor between Arlington and Darrington. So that's really exciting. That's an area that we knew before, during the Oso landslide, we had communication and access problems, and COVID has just made it even all the more obvious and important that we fix that. So, you know, these more rural parts of the county have traditionally relied on natural resources for their economic health and for jobs. And as those economies have shifted and those industries have ebbed and flowed, there really hasn't been much to replace it. So now with broadband access to rural parts of the county, we really are creating more opportunities and really be transformative for a lot of families and businesses in that corridor. And we're not going to stop there. We have other places within the county that we need to focus on. So we've got a lot of work to do, but we're really focused on making sure that we get the best broadband access we can to everybody within Snohomish County. And this is a huge step forward. So I really want to thank the State Department of Commerce, Ziply, and Snohomish County's Broadband Action Team for making this a reality. There's been a lot of people working on this, and it's just a great step forward, and we're really excited about it. So I'll leave it there, and I'll turn it over to Dr. Spitters. Doctor?
Well, thank you, Executive Summers, and good morning, everyone. Well, first, as we enter February here, I want to take a few moments to acknowledge what a difficult month January was for all of us. It felt like an entire year crammed into those 31 days with COVID infection rates climbing tenfold from their baseline in December, and then fortunately coming back down about a third off of their peak so far. The peak week, we had 16,000 cases reported. The week before last week, we were down to 9,000 cases. So things are headed in the right direction, but what a month. We saw not only case numbers, but hospitalizations surge to record-breaking levels. I'll cover a little bit more on that in just a minute. But in total, there were more than 50,000 confirmed cases identified here in Snohomish County during the month of January. And that likely translates into 100 to 200,000 people who miss school, work, or other daily life activities for a week or more, either because they were ill or because they were a close contact and had to quarantine. That means thousands of employers, schools, sports teams, childcare centers, and other organizations had to scramble to cover missed shifts or jump into action to identify close contacts and otherwise prioritize and triage their service delivery to their clients and customers. So these have really been long days and weeks for many people in the community. But we've also had some bright spots, and it is important to look back and recognize at some of these hard-fought achievements. Certainly at the top of the list, our healthcare system. Despite that system being pushed to its limits of capacity yet again, our healthcare system and its workers continue to rally, from caring for patients to expanding testing options to try to help meet the surging demand that we witnessed. Hospitalizations for COVID peaked at nearly twice their prior peak from earlier waves. While COVID hospitalizations are currently coming down off that peak about a third that was witnessed in mid-January, the surge is still stretching depleted resources in the acute care setting, and the anticipated decline in COVID hospitalizations will likely lag behind the decline in infections by 2 to 3 weeks. So we're not out of the woods yet, but there are glimmers of hope ahead. Local, state, and federal partners came together to stand up new testing and vaccine sites, including the ones here in Snohomish County. Free at-home test kits were made available by the state and federal government, and they are starting to arrive in homes. So the community has stepped up again and again with nearly 100,000 vaccinations being administered here in Snohomish County in the month of January. We're inching closer to 80% of our residents ages 5 years and up, 80% of eligible residents having initiated at least one dose. And about 90% of those have gotten both doses. And then of those who have gotten both doses, roughly 50% have gotten that booster. So we still have some work to do there. For those of you who are eligible to start vaccination or for that booster dose, again, meaning 5 months after you completed either Moderna or Pfizer, or 2 months after you completed Johnson & Johnson, please make an appointment to be the next person to reduce your chances of infection, hospitalization, or death due to COVID. We're also seeing people following recommendations to try to use higher quality masks. And Snohomish County just continues to show over and over how resilient we are. It's important to reflect on these efforts when we're feeling a little bit worn out after a month like January. But we did make it through, and we have the opportunity to continue turning the tide here as we enter February. As I said, we're not out of the woods yet. Although declining, the rate of transmission in the community is still very high and several times higher than previous historical highs. And our hospital system is still under great stress. Meanwhile, the long-term future remains uncertain with respect to the number, frequency, and impact of future surges in transmission due to new variants or other factors. So all of the standard prevention measures remain in effect: getting vaccinated and staying up to date with recommended boosters, masking with a high quality, good fitting mask in public, keeping indoor spaces well ventilated, especially in congregate settings, avoiding unnecessary gatherings, getting tested if you're symptomatic or exposed, and following isolation and quarantine guidance without waiting to hear from public health if you test positive. So I want to again thank everyone who continues to step up, and to those who answer the call when asked. We need to acknowledge where we've been and what we've gone through, but we also need to take moments to rest, to recuperate, fill our tanks before we keep moving forward. So with that, I'd like to turn it over to Kara to share more about what is happening on the resilience and recovery front. Kara?
Thank you, Dr. Spitters, for the introduction, and thank you for what is the good news at this point. So it's wonderful to meet you all. For those that haven't met me before, I'm going to talk a little bit about our recovery work that we're doing in the county. My name is Main-Hester. I'm the Chief Recovery and Resilience Officer for Snohomish County. I'm a bit of the new kid in school. I'm on month 4, and as I think a lot of folks would say, I'm going to be in the new kid in school for a little bit. So I came from the City of Seattle government, where I worked in finance policy on a range of issues, public safety, human services, community support, and also started my work there working on some of our COVID, started in the early months of the COVID pandemic, working on FEMA public assistance and kind of aligning all of our work in that space. So, and before that, I was the Deputy Director of the Seattle Animal Shelter, and I still have dogs and cats that have a deep spot in my heart. So, as many of you know, last year Executive Summers created the office, our Office of Recovery and Resilience. We are overseeing the $160 million in federal recovery funds that have been given to Snohomish County. And we are also partnering with some of our local jurisdictions to expand some of their programs, which is really exciting work. We work on everything from program and policy development, outreach, implementation and monitoring. That last part is kind of the not fun part of our federal funding, which takes some time. These dollars really do represent a massive but one-time influx in money for our Snohomish County communities. And so we really are focusing those investments on ensuring that we're working on issues that have been exacerbated by the pandemic to ensure that our recovery is as consistent across our whole community as possible. So some of those focus areas include affordable housing and shelter. We are also focused a lot on small business and worker support, particularly as our workforce dynamics have changed dramatically since, as compared to any other economic incident we've ever seen. We're also looking at childcare and workforce programs. We're recognizing that childcare both is a human service and a community support and a workforce support. And then finally, as Executive Summers mentioned, we have quite a project in broadband ensuring that equitable access across the county. We know that there are longstanding systemic challenges. So our goal is to not only address the impacts of the pandemic, but to make progress in those entrenched challenges as well to ensure a consistent recovery across our whole community. And so we've been working hard over the last couple months, and we have some new programs in childcare, new investments in childcare, community support programs, and senior services that will become available to our Snohomish County communities very soon. As we move on, we'll have more programs that roll out. I'll probably come back and talk about some of our new investments, which will be really interesting, and also provide you with more information on how not only you can get involved, but how you can get access to some of those programs. And finally, I would be remiss to mention we do still have rental assistance available as part of our pandemic response. But we do encourage folks that are struggling with rent to go ahead and call 211 today to find out if you qualify and apply. If you qualify and how to apply. So with that, I'll pass it back to Executive Summers.
Thank you, Kara. It's just really great to have you on the team. I'm very fortunate. Thank you. So let's see. Don't have any questions in chat yet. So any questions? There we go. Thank you. Hey, Doctor, could you elaborate on the data update from last week's numbers?
Sure. And if I'm not addressing your question. Please restate it. The number of cases reported weekly reached a peak of 16,000 during the week ending January 22. For the week ending January 29, this last Saturday, they came down to 9,000. So like a 30-40% reduction, consistent with projections that the infection wave will pass and decline, pretty rapidly here through the early weeks of February, with the hospital wave lagging behind that by 2 to 3 weeks.
So, Doctor, I think you mentioned when we were speaking the other day that there appears to be some slight easing in the hospitals in terms of cases.
That's right. So the peak hospitalizations, meaning the census, so the total number of beds filled at any one time with COVID patients, peaked at around 230. Roughly during the third week of January, and then that's come down about again about a third. There's 160, I think 165 Snohomish County hospital beds now filled with COVID patients, and that's projected to come down a little bit more slowly than infections, and get back down to baseline early March or so.
Okay, there's a follow-up. Well, when you say we're turning the corner, are we? Do you really feel we have turned the corner?
Well, turn the corner on this way by all means. And, I think nature kind of won on this one. We were fortunate in that severity was low, but the transmissibility of this strain really outstripped the ability of many of the prevention measures to interrupt transmission. However, fortunately, hospitalizations were proportionately lower than with previous waves due to the lower severity and the protection from vaccination, and then deaths were much smaller compared to previous waves of this size.
Do you think the new case infection rate is pretty steadily moving downward, or are we seeing a plateau that they've seen in other places? Any leveling off of the decline?
Not yet, no plateau yet. So only time will tell, and we'll just keep showing you the data as it evolves.
How about any concern about new varieties or variants?
Yeah. So there's this the naming system. These variants have sort of different parallel naming systems. And we're referring to the Omicron or B.1, 0.529, but another term for it is B.A.1, and then related to that is a B.A.2, which has emerged in some other parts of the world and may be more transmissible. We don't know much about severity or immune escape, but I think the early signals are that it's not much different in that behavior than Omicron, making it a variant of interest, but not a variant of concern at this time. But it really will take more work by international and national level public health experts and epidemiologists to reassure us on that front. Meanwhile, we stay tuned.
I'll just say that we have been fooled before. I'm very hopeful. I think this last wave was so rapid and so large that hopefully it's the last big wave, and anything else coming is ripples. But we've been fooled before, and so we are just maintaining our vigilance and preparations if there is a new wave. We're also turning an eye towards recovery and long-term resilience, but I think all bets are off in terms of whether there could be another wave or a new variant, and we'll just keep an eye out for it and keep doing what we've been doing and ask the public to keep their guard up. Masks are still the recommendation, social distancing, getting vaccinated, all those things are important, and that they can help us put this in the rearview mirror and make this the last wave. But if we let up, it increases our chances that we'll see, future variants. And so that's how we're thinking about it.
Couldn't agree more. Couldn't agree more. Thank you.
So the University of Washington researcher has called this the end of the pandemic. Doctor?
Well, it's I think informed and heartfelt and bold prediction. I think having a sense that on many occasions we prematurely declared victory over COVID, as Executive Summers has mentioned. I as a public health official, I'm more cautious in that I certainly hope that's the case. But thus far, no wave has been the last one, and I'm a little reluctant to make such a declaration.
So is there a concern that new data will be impacted by the new availability of at-home tests, where sick people might be less likely to actually report their positive cases to officials? So that's home testing versus sort of the mass test sites, public testing. Certainly.
And I think not a deep concern. There will be a change. There will be a larger proportion of diagnosed cases will occur at home and may be missed by the public health surveillance system. However, we continue to have a variety of surveillance tools like percent positivity in testing sites, hospitalizations, deaths, outbreaks that will remain on our radar screen and our dashboard, so to speak, for monitoring the course of the pandemic. So although there's some loss of information there's also a great gain in containment efforts if people can get tested more easily, more promptly, and then institute isolation in themselves if positive, and quarantine for their close contacts if indicated. That's a boon for the effort to control the pandemic. And I think really it's also important to keep in mind as we roll forward in future months, part of the public health lane of recovery will probably be a modified version of the current surveillance framework, where it seems unlikely to me that the intense level of counting every case is unlikely to persist indefinitely, and that we will transition more to sentinel surveillance to have an eye on what's going on, but not necessarily counting every case.
Kara, did you have anything to add? No? Okay. All right, following up on Bob's question, the UW researcher suggests that so many people will be vaccinated or infected that will go from pandemic to endemic. Any thoughts on that, Doctor?
Well, I think that's just I think that's a true statement. I don't think it's like a light switch, like we were pandemic and now tomorrow it's endemic. It's a transition. And what the course of nature and the interface between us and the virus is during that transition, I think does remain to be seen. And it could be very benign and unremarkable, or we could get another variant that spreads rapidly or that makes people sicker. So I think the general statement is true that that's where we're headed, but the time course and the bumpiness of the road between there and in here, I think remains to be determined, at least in my estimation.
Question for Kara. How has that $160 million pot been split up, and how much has not been spent, and how long do we have to use that money?
Well, excellent question. So of the $160 million, the county has actually only received $80 million of that. So the federal government does have to make the decision to provide us the second half. So we have not determined what the second half will be spent on. The first $80 million we've spent, or we have We intend to spend about $31 million on community support. So that's that housing, affordable housing, childcare assistance, senior centers, things like that. Another $17 million on economic and workforce recovery. $11.5 million is for public health. And to what Dr. Spitters just said, as you make that transition from response to recovery, we are planning, we do have some funding set aside for what that looks like. And then finally, about $20 million for both general government support to ensure that we can continue to pay employees within the government because of revenue loss, and premium pay for those first responders who worked throughout the pandemic.
Thank you. Is there any concern that declaring victory is premature and in an effort to give hope, it'll just cause people to let down their guard? Doctor, do you want to start? And I'll add some comments.
Yeah, well, certainly I would reflect back to your comments just a moment ago, Executive Summers, about that very notion that, yeah, prematurely letting our guard down, one, will slow the decline of the current wave and extend the stress on the healthcare system, which provides care to us all. So the faster we can get off this wave, the better for everyone. Whether or not you're affected by COVID, everyone has an interest in hospitals kind of getting back to standard operating procedures. The other is, you know, even if it doesn't have a short-term effect, if we, you know, I continue to submit, we don't really know what the future holds. We haven't experienced any long post-wave period of quietness during this. We've always gone right back up. And so I think it's, you know, if I say victory today and 6 or 8 weeks from now it's another wave, then I will have regretted those words. And I think it just warrants caution that we don't have a lot of good experience yet with getting out of the woods with this virus. So I think from my perspective as your public health official, we ought to behave as though we're still in the woods until we have stronger signals than just a waning surge to reassure us.
Yeah, I very much agree with that. And I think it's really important. Something we've tried to do is just be truthful with people and what we're seeing and what the data is showing, and having the information we're presented be quality and people trust it. So that's important. There are the dangers of, you know, we'll let up our guard. We've done it before, and people started getting back to more normal, and we've had waves because of that. But you know, we need to be honest with people and remind them that we've been through this before with several other waves. We don't know. We're hopeful that this might be the last big one and we're getting to a better place. But we've got to keep our guard up, and yeah, it's looking hopeful. But the best thing we can do to keep it hopeful and keep this trend going is to continue to wear masks and socially distance and be careful, and for gosh sakes, get vaccinated, because that's your ticket to good health outcomes if there are future waves, or if you haven't had it yet and likely still will get it. So keep our guard up, but look towards the spring. Questions?
Give it another 10 seconds just to see if there's any more questions. All right, otherwise we'll go ahead and wrap up. Thank you, Kara, Dr. Spitters, and Executive Summers. Thank you all for joining us. Again, this recording will be posted later on today, and stay tuned for future media availabilities. Have a great day.